Hi Healthy Buddy, I'm Dr. Tirta Wijaya. Welcome back to my channel where we will learn about various health matters. Today, we are going to learn about smoking cessation. If you or someone you care about is ready to quit smoking, you are in the right place. Quit smoking with confidence using this doctor-approved 5-step plan. Subscribe now to get health tips you can trust and act on. We all know how harmful smoking is, so I'm not going to explain the danger of smoking. But first, allow me to explain why it is difficult for smokers to stop, so we can use this understanding to get a better solution. Okay, many surveys found that about 2 out of 3 people who smoke say they want to quit, but many are unable to do so without help. It is because tobacco products have nicotine in them, and nicotine is addictive, causing mental, emotional, and physical dependence. People who are addicted to nicotine have strong urge to use and difficult to resist, even though they know that smoking is bad. Nicotine addiction can be as strong as other substance addictions like alcohol or drugs. The fact that many smokers started smoking younger than other substance abusers when their brains are still developing, making it more difficult to stop. The younger someone started smoking, the longer that person has been smoking, the more difficult it is to stop. That is why vape or electronic cigarettes or heated tobacco products usage is very problematic because they are introducing nicotine to younger and younger people. As per now, even without any long-term study available, I personally think that vape or e-cigarettes are bad. As bad as conventional smoking, or even worse than that, because they are targeting children. In this video, I group all kinds of tobacco use and nicotine addiction together. Information in this video is applicable to conventional smokers, vape, e-cigarette, or the heated tobacco product users. Smoking affecting your brain and body in several ways. Number 1, smoking is a highly efficient form of drug administration. The faster it is, the greater the rush and the more reinforcing the drug. Smoking produces high concentration of drug in the brain that are comparable to intravenous injection. Cigarettes in all forms are able to distribute nicotine rapidly through bloodstream and crossing the blood-brain barrier to enter the central nervous system, flooding your brain reward system with dopamine. I will explain about this in a short while. Nicotine triggers dopamine release by mimicking acetylcholine and binding to nicotinic cholinergic receptors in our brain. Our reward system is designed to reward us when we are doing things that ensure our species' survival, like eating, learning new things, winning a fight, or baby making. When we do those things, our brain releases a large amount of dopamine, making us feel good. So we are motivated to do the same thing to get more of that feeling. Some substances like sugar, caffeine, alcohol, nicotine can trick our brain to release dopamine in large amount into our system, causing happiness and distract us from unpleasant feelings. This makes us want to consume more of whatever it is to keep this feel-good hormone flowing. Nicotine also gives you a little adrenaline rush. Adrenaline or epinephrine makes your heart beat faster, your lungs breathe more efficiently, your blood vessels deliver blood to your brain and muscle more efficiently, your brain more alert, your body more ready for actions. It might not be high enough to be noticed, but enough to elevate your blood pressure and make it difficult for you to sleep. Number 2, as nicotine stimulates your brain over and over again, the number of binding sites in the brain is increasing along with the increasing level of nicotine in your body. More binding sites means more nicotine is needed to release the dopamine. In order to get the same level of happy feeling, you will need to increase the amount of nicotine you consume, either by smoking more often or increasing the nicotine concentration, or both. In other words, your brain is getting used to nicotine and develops tolerance. Number 3, nicotine reaches your brain in less than 10 seconds after using tobacco, and the nice happy feeling starts to disappear within few minutes after you stop, to be replaced with unpleasant feelings, often described as sour mouth, irritation, frustration, anxiety, difficulties to concentrate, or bored, or sleep disturbances, nightmare, or feeling hungry, depression, headaches, and many other things. This is called withdrawal symptoms, the mental, emotional, and physical sufferings when you stop smoking. Once you consume more nicotine, these unpleasant feelings go away. But if you stop smoking again, you might have worse withdrawal symptoms that force you to consume even more nicotine. Physically, your brain is reacting to the absence of nicotine. The more abundant it was, the more severe is the reaction on its absence. Emotionally, you just don't like the unpleasant feelings and you are emotionally attached to the smoking habit. That stop doing it make you feel kind of miss it. Mentally, you know that smoking is bad. You feel the same. But changing a habit requires a great mental strength. What started as the pursuit of happiness has turned to the avoidance of feeling awful. Nobody likes this feeling. That is why it is hard to stop smoking. The good news is nicotine withdrawal is not dangerous. It feels awful, but it won't kill you like nicotine will. The better news is withdrawal symptoms get better when your brain gets used to not having nicotine after you stop smoking. They usually start within few hours after you stop smoking, get worse as you keep not smoking, and reach the climax in 2 to 3 days when your body is cleared out of nicotine. From that point onwards, the withdrawal symptoms will get better as you stay nicotine-free. They can last for a few days to weeks, but definitely will get better as days goes by without nicotine. After knowing why it is hard to stop, next we will learn how to stop smoking or how to help your loved ones to stop smoking using this knowledge. If you like this kind of health information, please like this video and subscribe to continue getting health info like this. Step 1. Before you quit, identify your why. Do you want to be there for your children? Do you want to save some money? Do you want to avoid lung cancers? Or do you want to feel okay and look better? Just express it. Write it down. If you are a visual person, create a picture board of it. Place it somewhere in a way that catches your eye several times a day, every day, as a constant motivation, reminder for you to stop smoking. The list is very personal and may be different from person to person. That is fine. Be true to yourself and list out accordingly. Evidence shows that keeping a list of personal reasons boosts success significantly. If you are supporting someone else, ask that person, why does he or she want to quit? The motivations must be from the person quitting the nicotine, not from you. Many studies show that smokers with higher level of intrinsic motivations are more likely to achieve abstinence from smoking. Step 2. Choose a day to quit. Any day in the next week is fine. And tell your support circle, all your loved ones, family and friends who care about you, whom you care about. Tell them your plan to quit smoking and ask them to help, to remind you, to encourage you, and to support you in this. Having accountability makes a huge difference. You can tell me your quit date in the comment so I can cheer on you too. Meanwhile, you also need to declutter and sterilize your surrounding from smoking and tobacco-related things. Stop buying more supplies. Destroy your current stock of cigarettes, vape liquid, or anything that is related to your smoking or tobacco use. Dispose your ashtrays, lighters, e-cigarette devices, etc. Let go anything that reminds you of your smoking habit. For example, the photos of you smoking, the clothes with the burn marks, if it is smelly, reeking of cigarette, wash and clean, etc. to create a fresh, nicotine-free environment. If necessary, stay away from your smoking friends and places too. If your friends are supportive, they will understand. If they are not, then you have to flee away from temptations. Then, just stop smoking on the day you choose. If your loved ones are trying to quit, support them. You may help, but you should never do this on their behalf. Let them take the ownership of the process and make them accountable on their decision. Just be with them along their smoking cessation journey. Provide conducive environment free from nicotine-related things and support accordingly. Step 3. Get professional assistance. Many people can stop smoking on their own, but getting professional help is not something to be ashamed of. It can increase your success rate to stop smoking tremendously, especially if this is not your first attempt. You can use nicotine replacement therapy or NRT. It comes in patches, gums, lozenges, or inhaler. NRT is giving just enough nicotine level to relieve some of the withdrawal symptoms, but not all, to make it more bearable while retraining your brain to reduce the numbers of nicotine receptors. Using long-acting NRT with occasional short-acting NRT when necessary gives better result than using only one type of NRT. You can gradually decrease the nicotine you get from NRT over time, over several weeks, when your brain is used to lower levels of nicotine. And eventually, you can just stop using NRT altogether. Number 2, medications. For example, prescription like varenicline or bupropion. Prescribed medications work in several ways. They can decrease craving, mimic the nicotine effect on your brain without the real nicotine, or improve some withdrawal symptoms so you will not feel so bad, and reduce the enjoyment you get from the nicotine, making it easier for you to quit and stay quit. Number 3 is behavioral support like counseling, apps or hotlines or quit lines. Those 3 are the treatment options to stop smoking. You can utilize combinations of them or all of them. Generally speaking, combos are more effective than single therapy. Step 4 is managing cravings and withdrawal. The first 2 to 3 days after quitting is going to be the worst as withdrawal symptoms peak. On top of nicotine patch, you may need to use short-acting NRTs like gum, lozenges, or inhaler when the urge to smoke is too strong. You can try your best to use NRT as little as you can by applying these strategies. Number 1, avoid anything that reminds you of smoking. If you used to smoke during your lunch breaks, take a walk instead. If you smoke while drinking coffee in the morning, then change it. Drink water and eat some fruits instead. If you used to smoke while watching TV after work, replace it with a hobby that keeps your hands busy and your mind relaxed, like crocheting or woodworking, anything. You can spend time with your children, swim, tend your garden, etc. Be creative to replace your smoking-related habits with healthier alternatives. Number 2, acknowledge your urge and write down excuses that can trick you into smoking. For example,
today is a bad day, I need to smoke. I will stop smoking tomorrow. Or, my grandpa smoked and he had a long life. Or, people who don't smoke get lung cancers too.
there are many excuses, but acknowledge that they are excuses. Write down your own list of excuses and crush them. They are just excuses that have no power over you. Crush them, toss them. Number 3, deep breathing. Inhale the clean air slowly. Keep it in your lung for a few seconds. Then exhale slowly. Close your eyes while you do the deep breathing and remind yourself of your motivation, why you quit smoking. Refer back to your list or picture board you made in the first step to help. Number 4, if you really feel that you have to smoke there and then, try to delay. Don't get the cigarette or NRT right away. Tell yourself to wait for 10 minutes for the urge to subside. Do something to distract yourself from the urge to get the nicotine. Drink water, chew some straws or carrots, sing, do push-ups, squat jumps, anything safe and healthy to tide you through the delay. Oftentimes, it takes less than 5 minutes for the urge to pass. Number 5, manage your stress. Get 7 to 9 hours of sleep, a good quality sleep a day. Exercise regularly in moderate intensity, about 30 to 60 minutes every day, and keep yourself busy during your free time with healthy activities unrelated to smoking. Doing activities with your loved ones can keep you accountable as they can remind you when you are tempted to smoke. Number 6, avoid alcohol as it is making more difficult for you to control yourself. Many people manage to stop smoking by distracting themselves with healthier alternatives. It works. You are not weak. You are not fooling yourself. It is just how the brain works. You have to be strong and firm to control your mind while your brain is adapting to lower level of nicotine. If you are supporting your loved ones to stop smoking, ask them whether they want you to check on them regularly and ensure them that you are there for them. Listen to them. Spend time with them. When they are fighting the urge to smoke, you can offer to do activities together to distract them from the urge, like cycling, playing tennis, etc. If you are living together, make sure your home is nicotine-free and there is always fresh fruits or vegetable ready for them to munch on. Step 5 is preventing relapse and celebrating milestones. Staying nicotine-free is the most important part of the process. About 80% of smokers who try to quit on their own relapse within few months of abstinence, and only about 3% remain abstinent at 6 months. So, stay vigilant and get help. You don't have to face this alone. Try to remember your reason for quitting. Refer back to the list of or picture board you made in the first step again and again and again. Think of all the benefits to your health, to your family, and your finances. Number 2, tell everyone you come across about your progress as your smoking pals to support. Post on your social medias about how long you have been smoke-free. You are winning this battle against the addiction, and it is something you can be proud of. Number 3, reward non-smoking time. Celebrate it with your loved ones. Treat yourself in a healthy way. Number 4, get rid of any excuse to smoke. Don't fool yourself by thinking
That is only one. That one cigarette is not a big deal.
you are the victor of this war against addiction. Don't let a single puff defeat you. Number 5, use and reuse again the strategies in step 3 and step 4 if you need. Continue the counseling. Keep yourself active and accountable. Do anything to keep you away from nicotine. If you use nicotine again, if you slip, take it as a lesson, not as a failure. A slip is a minor mistake that can be corrected quickly. Review what was wrong and renew your commitment to be nicotine-free for good. You defeated your addiction before. You can do it again this time. A slip is not an excuse to go back to smoking. There is no right excuse to use nicotine. None. Zero. But if you do relapse, don't be too discouraged. Most people tried several times before they are able to quit smoking for good. So get up and try again. For family or friends who are supporting someone to quit smoking, you can encourage your loved one to stop smoking. Don't preach, don't lecture, don't nag. Never doubt their ability to quit. Instead of that, remind them of their reasons to quit smoking. Then don't offer advice. Offer help instead, as much as you can. You can provide conducive environment, and you can ask how you can help them. Let them take the ownership of the process. Then thank the person for quitting smoking, for not exposing others around them to harmful secondhand smoke. It is not easy to stop smoking. You can make their effort worthy by showing your acknowledgement and appreciation. Celebrate the non-smoking days. Every nicotine-free day is a blessing to be rejoiced. Then be patient. Withdrawal symptoms may make the person grumpy and irritable or even annoying. Remind them and yourself that this condition is part of the cessation process and it will get better with time without the nicotine. Then continue your encouragement and support to try again if they slip or relapse. Take it as a practice for the next try. Your support could be the difference between relapse and lasting success. If you yourself are a smoker, stop smoking together with your loved ones. That is my sharing today about smoking cessation. I hope you found this useful. If you have any health-related questions or topics you'd like me to cover in future videos, feel free to write them in the comment section below. I read everyone. However, just a friendly reminder, I can't provide personal medical consultations here. It is always best to discuss your individual condition directly with your doctor. Please remember to like this video and subscribe to this channel to get more content like this. Stay healthy and happy.